Hi there. So, I wanted to talk about the recent measures that have been extended in order to continue the mass shutdowns, but also the illegal gathering of groups of people, the self isolationism measures. Um, so, there are a number of concerns that I and many other people have at the moment. Um, and those concerns are both about the short term, but much more importantly, more profoundly, about the longer term possible implications. Um, I think that there are many risks in terms of those people with moderate to severe mental health or emotional problems, and of course, those people that live with others that have those type of problems as well. Um, and I think I've written some notes about it actually. Increased risks of pathological mental disorders for those with moderate to severe problems. Those more dependent upon support groups will struggle much more as this goes on much longer. And that stands to reason that people with moderate to very severe issues may well struggle a lot more, especially as the measures continue much longer. Risks perhaps of anger issues, depression, addiction issues, alcoholism, drug abuse, perhaps anxiety disorders, dream reality confusion, where you're not able to tell what's going on in life due to the shortage of information, not seeing other people, paranoia, aggression, self abuse, spousal abuse, domestic abuse more generally. So there are all these kind of possible risk factors, and there may well be increased risks for those even with suicidal and homicidal tendencies if they are under enough stress and without enough support for a prolonged period of time. Can these risks, however, be mitigated? And I've considered yes and no. Online and through telephonic support, we will be able to perhaps help to some extent, but may not be as effective as in person, one to one, or group therapy. Even so, support through technological methods, whilst inferior to communication in person, still can provide a degree of support and would be significantly better than no support at all. However, online support through social media could, depending on how it is, be as damaging as it is helpful, depending on the nature of those communications. That is to say, social networks could provide encounters that both increase or help to alleviate those stresses. The vast majority of us, the vast majority of those with most severe psychosocial problems will probably have some recognition already of those long term struggles, and they are more likely to have regular allocated support in place already. A continuity of care will likely continue from key workers like support workers or care assistants who will be visiting individuals at their homes, or the staff working at supported houses. This support will depend on the availability, though, of such key workers in order to maintain the contact with their clients. However, there will be a significantly larger group who have less severe problems and so don't therefore have the official diagnosis or some care in place in a formal capacity. This group is the most concerning, more than those with severe issues, even if that's counterintuitive, because they will have no formalized recognition of their support needs. They will have no access to all their support groups or care workers that they would be regularly seeing. They have enough problems that they are more dependent upon support groups than those perhaps with more minor mental or emotional health problems. And during isolation, they will therefore face significant problems. This group is the more concerning than those with severe issues because they have no guaranteed continuity of support. Their support groups tending to be more informal through contacts perhaps with friends or family. It is thus critical for contacts to try to help support them through whatever means are available. This additional struggle for those with moderate mental health problems is that many of their contacts will perhaps also have similar challenges too. Thus, without sufficient support from many others, it will become the blind leading the blind, or the mentally ill caring for the mentally ill. This in itself has the potential to be both a great opportunity for learning and developing abilities to rising to the challenge of striving to help support each other more. In short, it will be more likely that people will want to care for others if, in order to do that, they have to also care for themselves to a degree. But there are, however, many dangers of this increased responsibility of overburdening people beyond their capacity to cope and overwhelming them mentally and emotionally, and not providing the adequate levels of care to each other that could lead to destabilizing situations and those risk factors of self-harm and other factors that I've mentioned earlier. There are many other potentially at-risk groups as well, aside from those with long-term psychosocial or emotional mental health needs. If we consider, for example, children especially, those that are separated from other family members that they may have a close relationship in particular to, at least at the moment, I'm told, children of divorced parents are able to share their time visiting both mum and dad. So at least that's something. But children will also miss the interaction of the wider family too. But they'll also miss their own friends that they will depend upon much more. Children and adolescents as well, they tend to benefit much more and need much more the social support of their peers. If you can sort of remember back to when you were that age, you probably had spent a lot more time in social groups. It's much more important whilst you're going through those developmental stages. And so in the longer term, prolonged isolation could potentially have a much more damaging effect both on adolescents but also children in terms of their development and their progress abilities. But also if you consider single parents, people that might have depended upon the extended family and other friends to help support them with their duties, those people that had received help and support, not just practical, but also emotional and mental support too, they may too be struggling with that. I'm thinking as well as about key workers that have got these jobs they're doing, but also have responsibilities at home as well with their family members. You know, they may well be finding the struggle quite difficult for them. Another group that may well be struggling as the time goes on are the elderly. Due to the vulnerable nature, many of them may be even more isolated than they would normally be. Many elderly people, sadly, have gone through prolonged periods of isolation anyway, to a varying extent, but sadly that's the case for so many actually. There are some that only have very limited visits, that are very occasional. So you wonder how they're coping really. And many of the elderly, of course, do have issues with technology and are not able to sort of use computers as well to contact people. But at least they have telephones and writing letters, at least. I know some of the silver surfers, as they're called, they may well be able to still use a computer at least. Or going back to the issue with adolescents, there may well be an issue with them using and relying on that technological support. So at least they can talk to friends through various internet chat rooms, through Skype and Zoom and Facebook chat and all sorts. But of course, there's also the risk as well. Social media comes with its own risks too. The risk of strangers trying to groom them. Sadly, that occurs. You don't know who you're always talking to online, of course. So it's really important that parents are talking to adolescents and children about how they're using the technologies online. There could also be many other vulnerable groups I'm going to come on to talk about specifically now. Those with weak and compromised immune systems specifically. Those are the people that are the at-risk group from all infections, not just this one, but from other infections that are more common anyway, that kill tens of thousands of people in this country each year normally. Those people are really at risk from this, but infections generally also. And you would hope that the care workers visiting them are being given all the correct equipment, the masks, the gloves, the sanitizers. I've heard many reports, as we have now, that they're running out of masks, and there seems to be shortages of those, sadly. But you would also hope that care workers with symptoms would not be visiting, and those care workers living with family members that might have symptoms should not be visiting either. But that should remain true, in fact, for all infectious diseases. In actual fact, that should have been the case for many, many years anyway. I know that some staff over the years, from my experience in home care, had to go and visit vulnerable clients, however, just because they had chronic staff shortages going on. So sometimes it was a case of somebody with the flu going to visit a person who was vulnerable with a compromised immune system, or nobody going to visit them. But at least they took precautions of using masks. So hopefully we'll get more volunteers joining home care and care homes, as well as care assistants, to help support whatever staff shortages there might be there. But it's not just supporting people with those critical illnesses in a practical capacity as care assistants visit. It's also allowing them to visit and provide that emotional support, because actually going through a long-term chronic illness can actually take its toll emotionally on you, and also for other family members to provide support through telephone, writing letters, emails, Facebook, Skyping, or whatever method of communication is appropriate. Now, the other group of people quite concerning are people with other long-term illnesses, other physical long-term illnesses, that is. Not necessarily those with weak, compromised immune systems, but there are a wide variety of other serious physical illnesses. And I think there have been some really concerning reports that I found recently. There was a report that stated up to 50% of A&E admissions were down at the moment from this time last year. And you really wonder why that might be. There's a number of different reasons. It could be because there's less accidents at the moment. If people are going out less due to the self-isolationism, it may be that there are less opportunities, therefore, for accidents. There are less people going out to nightclubs, getting drunk and getting into fights, for example. So there could be an element of that. But it could also be that some people with long-term chronic conditions that could be going through difficult situations, maybe experiencing pains, they may be deciding not to go to an A&E ward out of fear that they may contract an infection on top of their already existing conditions. And that's quite a understandable concern, given the fact that over 99% of people allegedly dying of the COVID-19 strain of coronavirus do actually have those long-term pre-existing conditions. And I wonder why they can't have in hospitals infectious wards that are kept separate from A&E wards, to allow people to go in there to those wards that have those long-term chronic illnesses, like issues with heart disease. Well, you know what? Cardiovascular disease is the biggest killer. It kills something like well over 9 million people, I think, globally. Vast numbers of people. So I think it's something that is really concerning. Whether people are just avoiding going to hospitals, and if they are doing that, if left unattended, what is the consequence of that? And what reassurances, therefore, can hospitals give to try and help give provisions to those in chronic conditions going through sufferings in a lot of pain that may be worsening? Can they be treated with a low risk of infection? It'd be interesting to sort of find out more about that, actually. In terms of hospital numbers being quite low at the moment, the Financial Times reported recently that half of UK hospital beds are currently empty, with 60% of the acute beds occupied, but 30% less than this time last year. I mean, they were gearing up and prepared for this anticipated massive amount of coronavirus COVID-19 patients, but we haven't seen those hospital beds yet to be filled. So there's huge numbers of empty beds at the moment, and they cancelled vast numbers of hospital appointments and treatments in order to make room for those. The Health Service Journal, the HSJ, it reported that the NHS has 4 times as many beds as normal, and 40% of the acute beds are currently unoccupied. So it makes you think all those people that maybe have got serious issues, they may be having tests, checkup appointments, maybe treatments even that are being all delayed at the moment for the anticipation of a surge that hasn't yet materialized. So you wonder what will be the effect of the delay in terms of appointments and all those treatments. Another report I read suggested it's going to take up to 5 years to reschedule all those appointments, but I'm not sure how many of those are absolutely necessary and critical, and what effect that will have on some. Professor John Haworth, who works for the North Cumbria Integrated Care NHS Foundation Trust, Professor Haworth reported recently, "I am really worried that people are not seeking the help they need for important conditions other than COVID-19. That's a direct quote from Professor Haworth. The Health Service Journal, the HSJ, it reports that, and I quote, "There could be some very serious unintended consequences. While there will be a lot of COVID-19 fatalities, we could end up losing far more years of life because of fatalities relating to non-COVID-19 health complications." So there's really huge concern for many medical professionals at the moment about people not getting the treatment they need for these really long-term serious health conditions. It'd be really interesting to see how that's being addressed by health chiefs over the next few days. Sarah Scobie, who's deputy director at the Nuffield Trust, she reported, and I quote, "The PHE," that's the Public Health England, "the PHE data suggests there could be significant problems already developing for heart disease related conditions for patients. For example, attendees relating to myocardial infarction at emergency departments have dropped right down, whereas ambulance calls in relation to chest pains have also gone up." She obviously has concerns about the risk there, and I can see why. It's an ongoing, ever-changing situation at the moment, and I think it's one that merits a lot more investigation. And I'm not, I'm just sort of highlighting some of the brief points of those And I think it's all of our duty to sort of investigate and sort of try and look at different accurate sources to find out more information about that. Because in a practical sense, it might assist us in terms of helping other people that may be at risk in vulnerable situations. So it may sort of help in the short term, guiding us as to how best to sort of mitigate those risks. What are the potential things that we can do in a practical sense to help others? But it's also recognizing what the long-term risks could be as well. There's also another potential that I was thinking about earlier on in terms of what the actual potential effects could be of these measures. The effects on policing is another possibility. Police are being asked by the government at the moment to police the new coronavirus measures that were recently rushed through in legislation, banning large groups from meeting up, banning any gathering of people, in fact, limiting people going out to essential visits to hospitals and pharmacists and to get food shopping in as well. Although the government clarified that one is allowed legally to go out for daily exercise too. But the policing of groups of people meeting up will obviously require an extra amount of police force at the moment. And if one recalls, we've just gone through some serious cutbacks over the years through the austerity measures of the government. And so, in fact, of course, we've got more laws for the police now to be policing, but with a lot less staff. And in fact, recently it was reported that perhaps up to 1 in 10 police officers could even be out of service at the moment due to the self-isolation measures of being suspected of having had or having symptoms. So with a reduced austerity police force being expected to cover even more laws going on. Now, what effect will that have with stretched resources already on their ability to police other important crimes? Think of, domestic abuse that could be going on, child abuse, think of violent crimes, GBH, think of a whole wealth of different crimes that could potentially be under policed, therefore, because police services are being taken up in policing, and parks, streets. I've spotted police all around shops, parks, streets, all over the place. But you wonder, therefore, if their time is being taken up doing that, what limited resources are going to be left to make sure the most vulnerable members of our community are being protected, those at serious risks of financial, physical, mental, emotional, and even sexual abuse that could be taking place. How do we know the extent of that going on behind closed doors? And especially if policing numbers now are even more severely limited due to the self-isolation measures. So that is another concerning issue, about crime more generally. And especially my concern in that is crime like of a serious offensive nature, like serious abuse, and what kind of effect that's going to have, I suppose. So there's a whole wide range of issues at the moment to be concerned about, and all the more reason to sort of study those issues and sort of find out as much accurate information about them as possible, I suppose.